it was recommended to me by my consultant. I was diagnosed with myelofibrosis just over 2 years ago now, and so obviously I had to deal with that news straight away. And then I was put on treatment, and I was having loads and loads of side effects from the treatment. So I was really not in a good place. So my consultant said that we have this facility now. I think it could help you. I can help you with your physical health, but I can't do anything about your mental health. So she recommended me to see Dr. Biswas. I spoke with my partner, and obviously she'd been suffering at my hand, sort of thing. We both agreed, well, it can't do any harm, and it hopefully would do some good. So I said yes to it, and then Dr. Rashid obviously gave my details to Dr. Biswas, and I got a letter from her, and I went on from there. Really. Basically, straightforward. Just asked how things have been going and what's been occurring in my life since the last time I'd seen her, how to deal with it, or how to see it from perhaps a different perspective. It definitely has. I think there's a lot of things happened and is happening in my life itself. A lot of the time, it was like, for goodness sake, X, Y, and Z is happening, and I've also got cancer to deal with. I was having issues with the fact that I look well, but sometimes I feel terrible. What I was told is that really I hadn't come to terms with having it. I accepted I had it, but I hadn't really come to terms with having it. Quite early on, we used the scenario of how many spinning plates I had and how many plates I was trying to keep spinning at any one time, and whether there were any of those plates that I could allow to fall, or perhaps pass over to Kathy, my partner, to deal with. I was helped in coming to terms with, I don't have to do everything. It's not my job to do everything. I feel like I am able to cope better with the day-to-day things that are happening. We've sort of realised now that I'm talking to her more about the issues of the day rather than the cancer side of things. The way it was handled was that it just made me think differently about things, or maybe look at things from a different perspective. One of the biggest things is that it has helped me to come to terms with having the cancer. It's not at the forefront of my mind anymore, and I think that was, that's been helped by the counselling. A go, really. Like I said at the beginning, we discussed it and thought, well, it can't do any harm. I'm in a much better place than I was.